but I'm here. I'm here with you.
Hello. I
Yay.
think we
We're
are
live.
live. Welcome, welcome.
And I
We
can
are going to
hear
give
you.
it good, and I can hear
I
you.
don't have any technical difficulties.
So we're going to give it a few seconds for people to kind of come on board. And we are really excited to be here. Dr. Renaud,
Yeah,
how was your day today? Did you see patients today?
I did. It was busy day,
Busy
but it's
day?
my last day of seeing patients for the week. I had a lot of, it was funny because I had a lot of female health patients this week, and we're doing men's health.
That's right.
So it's always that
And I,
way.
and
But
I had some men's health patients today when I
I did
was,
too. But
yeah,
my
I was
majority was women this week.
letting them know about our podcast today.
Same.
Well, welcome to our viewers. We have a super exciting topic today that I know I have been looking forward to, and we are going to be talking largely about men's sexual health. We had an episode last week about women's sexual health. And if you haven't joined us before, we do podcast episodes, the Med Matrix Method podcast, 1 to 2 times a week. We talk about all things functional medicine. I'd love to just start with my esteemed colleague, Dr. Colin Renaud. If you want to introduce yourself, tell our viewers a little bit about yourself, that would be great.
Sure. Yeah, I'm Dr. Renaud. I'm one of the clinicians here at Med Matrix. I have a pretty unique background. My doctorate's in chiropractic medicine. I have a master's degree in nutrition. I practice medicine as a PA, and I'm also fellowship trained in functional medicine, as well as I'm board certified in anti-aging medicine. So I have a pretty unique background, and I've been practicing functional medicine for a little over 10 years. I specialize in, we were just talking about men's sexual health, women's health, gut health issues, nutrition, weight loss, you name it. So yeah, what about you?
Yeah.
Tell us a little bit about you.
My name is Dr. Sasha Rose. I'm a naturopathic doctor. I'm a licensed acupuncturist. Along with Dr. Renaud, one of the lead providers here at Med Matrix. I've been practicing functional medicine for over 20 years. A huge part of that is hormonal health, hormonal optimization for men and women. So this topic, sexual health, is I think really important, and I think we had a great episode last week. I'm really excited to dive into men's sexual health today. A couple things just at the outset. Everything today is educational only. We are not giving medical advice. If you are interested, at the end of the visit, if you are interested in pursuing, becoming a patient at Med Matrix, please visit the website. You can book a discovery call. But today, it's going to be chock full of information, but it is kind of educational only. So I think people are still kind of coming on.
We're going to do questions too. If they have
we're going to do, so the structure of this is we're going to be doing a lot of kind of diving into the topic of men's sexual health. And then we are going to have some time at the end for questions. So please leave comments. We will, try to get to as many of the questions as possible. And let's start. Do you have anything else that you want to add before we kind of dive into the topic, Dr. Renaud?
No, I'm really excited. This is, as you said, this is part 2 of our sexual health podcast series. We talked a lot about women's sexual health last week. I think we had a really great discussion. So we're sort of turning the tables, and we're not trying to be sexist about it, but Dr. Rose took the lead on women's sexual health, and I'm going to take the lead on men's sexual health. But we both do see both sexes. We have a lot of experience doing both. So I'm excited because I think there's a lot to say from a perspective on men's health. And I think it's important for men to understand that, as we talked about with women, that health in relation to their sexual life is not just I'm getting old or aging,
Mm-hmm.
right? There's a lot of things that happen from the perspective of like actual medical things changing, physiology. So I think it's a really important topic. And I think it's important for, if you're, in a relationship, like, husband and wife, or if you're, in a two male relationship, whatever. I think it's important to kind of learn about each other's sexual health things. It's helpful to understand each other better from like a medical perspective. So I think this podcast is important for women to listen to. I think last week's was important for men to listen to, vice versa. So I think it's really going to be quite fun, quite interesting.
Absolutely. And I think that we talked about this last week too. Just I feel like this is an opportunity for there to be more openness about sexual health, and hopefully to kind of for people to feel permission to discuss issues with sexual health and intimacy with their providers, with their partners, and just to kind of maybe take some of that shame or taboo away from that, because I think that's unfortunately has often been the case, even kind of again within a medical visit. So um, let's start. So a lot of men often think that changes in libido or erectile function, as you kind of mentioned, it's just inevitable. It's just part of aging. From a medical perspective, do you tell me how you talk to your patients about this? Do you feel like we should view these symptoms as potential health signals that are maybe go beyond libido and erectile function, or is that where it ends? Is it just part of aging?
Yeah, I mean, it's definitely not. I mean, it can be, right? Because you can certainly have the aging of the body from like vascular change, right? And erection is really the health of blood flow to the penis, and you have to have certain level of health to tissue for it to work.
Mm-hmm.
So, but most of my male, a lot, not most, a good bit of my male patients who are interested in addressing sexual health issues when they come to us as MedMatrix, to really get a functional approach on their health is really to understand, okay, well, I am getting erectile issues, or I am getting just a change in my libido, or men sometimes they can kind of not understand, like, well, what's appropriate? Am I just
Mm-hmm.
supposed to not feel so sexual? I'm 50 years old, I'm 60 years old. And it's like, no, you have the ability and you should have the interest to have a, sexual desire through old age, through like the time you die, really. So for both men and women. So a lot of men will come to us and we get the chief concern of erectile dysfunction, or erections are not as strong, or I have issues with, premature like ejaculation, or I just don't feel like I have the same stamina like I used to.
Mm-hmm.
So I think one of the things that I try to educate men on is health of sexual stamina, whether it's the mental part or the physical part,
Mm-hmm.
is really multifactorial. We talk about hormone health. There's a vascular component. There's neurological component. There's a level of cardiovascular disease that we have to be worried about, metabolic dysfunction. And then also, we talked about this a lot with women, and you made an extremely important point when we talk about with women, but men the same. If men don't feel mentally prepared
Mm-hmm.
for sexual activity or something, and men, I think most men understand this, because when it comes to erection health, men have to have the wherewithal mentally. We talked a lot about the parasympathetic nervous system and the sympathetic nervous system, basically your rest and digest part of your nervous system, the parasympathetic versus the fight or flight. So in order for a man to achieve an erection, you have to have the parasympathetics activated, which is your calming nervous system. If you're ultra stressed, if you're, having issues in your relationship, if there's friction in the home, if there's financial issues, children issues, you're not going to want to be sexual, right?
Mm-hmm.
It's sort of
Mm-hmm.
maybe the last thing on your mind. So I do have a lot of men that feel a sense of shame
Mm.
when it comes to erectile issues or sexual issues because they feel like they're the performers, right?
Mhm.
They have to be the performing part of the sexual act if it's, with whoever their partner is. So that's a big thing. So it's not only physical, it's mental, it's stress, it's hormones.
Mhm.
If a patient was a smoker and there was smoking affects vasculature, the penis, there's lots of different things. So really it's trying to understand where the man is
Sure.
from a health perspective of all these different variables. It's really important.
Okay.
So yeah, that's where the discussion really starts.
Okay. If you're just joining us now, we are talking about men's sexual health. We're talking about libido and desire today. If there are some subjects that might not be appropriate for a younger audience, so if you feel that you want to kind of keep this podcast private, this might be the time to pop in
Yeah, your headphones.
the headphones, the AirPods. And then, we said this earlier, we'll say it again, that this is really educational only. Nothing is really medical advice during this podcast. So I think we've talked about this a little bit. Let's touch on it again. Maybe other than erectile dysfunction, what are, as sexual health might be declining, what are some additional signs or symptoms that you might see, or that you're kind of, when you're questioning a male patient, what are you asking about?
Yeah. So a lot of men we talked about the erections, and
Mhm.
the erection is really just the physical manifestation of something. But as we said, there can be reduction in libido, where the desire is reduced, and that could be very multifactorial. As I mentioned a few moments ago, it can be
Mhm.
physiological, it can be mental, it can be a physical thing. So there's that part of it. Also, a lot of men that I see, aside from erectile or sexual dysfunction, a lot of men complain of low energy and low motivation. And I feel as though a lot of my male patients really they take this part to heart,
Mm.
sometimes too with the physical, because uh, um, you know, and we're generalizing things here too. We're not trying to overcomplicate, but we are making some generalizations. But a lot of my male patients, they'll talk about, their motivation is low, so they feel like they're not being what they need to be as maybe a paternal figure,
Mm.
or a spouse, as a husband, right? I don't feel like I'm giving enough to my family. I don't feel like I have the energy when I come home from work to play with my kids, or like they want to go outside, they want to go somewhere, and it's like I just don't have the energy for that. Or they feel like they're not giving enough to their spouse, like they just want to come home and put their feet up and just drown in TV.
Mm.
And they feel, and I feel this from men a lot, is they feel very disconnected, but it's a lack of motivation, and it's like a physiological lack of motivation where they just don't have the drive for much, and they have to go to work because they have to provide. They need, there's really no choice there. But when they come home, they can sort of shut off, and there is a little bit of guilt that I see from men where they
Sure.
just don't feel like they're giving enough to their family unit
Mhm.
potentially.
Mhm.
And a lot of guys talk about a reduction in confidence or just a sense of well-being. I just don't feel like myself. I just don't feel like, that vitality that I used to have in my 30s and 40s. I don't feel sexually vital. I don't feel good about the way I physically look. Maybe I've gained weight. Maybe I've lost muscle mass. Maybe I'm not as strong. There's this,
Sure.
I think there's this instinctual, and again, we're not trying to be sexist or generalize, but I think there is in some men, in a lot of men that I've treated over the years, there's this instinctual sort of biological drive to want to
Mhm.
be strong, to want to be
Sure.
fit, to want to succeed, to want to provide. And when men start to lose that, I think they start to lose their self-confidence or their ability to be a good spouse or a good parent. So we talk about obviously sexual health, but this kind of translates into interdynamics of family relationships. And, I don't feel like I'm connecting with my kids. I don't feel like I'm connecting with my spouse, or, so a lot of these things will occur together. They kind of overlap. So those are a lot of things I see with men,
Okay.
mostly, and I'm sure you do too. If you
Absolutely.
have things
Yeah.
you see, I'd love your input too. If you see other things, but that's what I see a lot of times.
Yeah, no, I think that covers it. And I think it's interesting in the context of sexual health, because I think people wouldn't necessarily bring something like confidence into that dialogue, but I think it is part of it. Um, Talk
Definitely.
to me about testosterone, because I think that's usually the first thing, the first hormone that comes to mind when we're talking about men and sexual health. Um, Give us a rundown of the role that testosterone plays, um, and again, in libido, in performance, in overall health. Yeah, let's start with
Yeah.
testosterone.
Yeah, testosterone is the main male sexual hormone. Women have testosterone. Each sex has all three of the major hormones: estrogen, progesterone, testosterone. But men dominate with testosterone. That's where we get our secondary sexual characteristics from, in terms of like when a man goes through puberty, the size of the penis increases from testosterone. You get an increase in body hair, deepening of the voice, growth of muscle mass. And we talk about like male physical features versus female features, more feminine facial features versus masculine. There's all kinds of things, but testosterone really is the hormone that can play a significant role for men in desire, vitality, sexual sort of desire and want, energy levels, like I said, muscle mass. Testosterone plays a major role for a man's mood. A lot of men with low or suboptimal testosterone can have anxiety, depression, just feel low,
Mm-hmm.
feel generally low. Like I've had that said to me so many times. I just
Mm-hmm.
feel low, or my mood feels depressed. I'm not sad. I just feel kind of something, like a black cloud kind of
Sure.
feeling.
Okay.
Um, so testosterone is not just it is the muscles and the sex. The
Sure.
stereotypical,
Yeah.
like, I want muscles and I want to get an erection and I want to have
Right.
sex. Okay, great. That's a big part of it.
Okay.
But and not to make light of that, it's important, but testosterone is so important for every single cell of a man's body. There are
Mm-hmm.
testosterone receptors on every cell. So it's important for your brain, it's important for your heart, it's important for your muscles, your bones. There are studies that show that low levels of testosterone have been linked to neurodegenerative decline. Things like Alzheimer's, dementia, other types of neurocognitive decline. Um, I have had men that have uncontrolled diabetes that have low testosterone,
Mm-hmm.
and we get the testosterone better. The diabetes just shoots right down. They
Mm-hmm.
become non-diabetic. Blood pressure is affected by testosterone. Cholesterol is affected by testosterone. So it's really a multi-system, whole body hormone. And like I was saying, it is a longevity hormone. It keeps men
Sure.
young, keeps your muscles strong, keeps your bones healthy, keeps your brain healthy. So it is really important, and I always try to educate men on the role testosterone plays as we age. So about around age 35 to 40, and I would argue that that's actually getting less. It's getting earlier now.
Yeah.
Um, we had a whole podcast on the effects of toxins on hormones and, all the things that we're exposed to and how they affect our hormonal health. So I am seeing men with testosterone that is suboptimal in earlier years in their 20s and 30s. I'm sure you are too, Dr. Rose.
Absolutely.
So there is an age-related decline. On average, about age 35 to 40, you will start to lose about 1 to 2% of your testosterone every year until you die.
Mm-hmm.
That is just the natural aging process of a man. So, and it's not like when you turn 50 or 60, you'll get this just resurgence of like, oh, the testosterone that's been in a savings account and it pops out when I'm 50. Nope, not a
That would be
thing.
nice.
I know that would be so nice if we got this like reserve that we've been saving up for, but it doesn't work that way. Same thing with
Something to look
women when we
forward
talked all
to,
about,
right?
yeah, when we talked about women in menopause, you just don't get the hormones back. So
Mhm.
as age comes with, time, there is this age-related decline. So a lot of my men will go to their doctors, their primary care doctor, family doctor, complaining about these symptoms that we've talked about, and they will get their labs drawn, maybe if they're
Mhm.
lucky.
Mhm.
Sometimes they don't, for testosterone. And the testosterone is quote unquote normal, but it's on the very low end of normal. So they're told, oh, well, you're fine. But in reality, they're really not. And the literature does support that. There are studies that show these reference ranges that we use for testosterone are not accurate. Men are getting symptomatic before they're actually on the low range. So as functional medicine providers, you and I know that, and that's how we educate patients. But a lot of times men are maybe going 5, 10 or more years with symptoms of low testosterone, but they may not be getting treatment because they're not actually in the low range on a lab, technically. So that's a really big, important part of this that I think is important to mention because as we talked about with women go through the same thing. There's menopausal change for 15 years sometimes or more before women have any sort of intervention, potentially. Same thing with men. And all the signs and symptoms are there, but if the labs don't show it exactly right, they'll be dismissed. So
exactly.
Yeah. Do you have any other thoughts? Did I miss anything?
No, I think that's really complete.
Yeah. Because there are other hormones that we should talk about.
I was just going to say
too.
that was I was going to say
Yeah.
talk, I think in general the focus with men's sexual health and libido is always about testosterone. It clearly is really important. Talk to us a little bit about some of the other hormones that need to be looked at, included, evaluated. Just kind of included in that conversation when we're talking about low libido, erectile dysfunction.
Yeah. So obviously testosterone is the main one, but as I said a few minutes ago, both sexes have all the hormones. So estrogen is really important for men as well. And a lot of times when men have low testosterone, they have low estrogen because essentially estrogen is made from testosterone sometimes. I mean, we also can there's other hormones like DHEA, which is a precursor to your sex hormones. But estrogen is really important to be balanced for men because, believe it or not, even though estrogen is kind of one of the female dominant hormones, men need estrogen to get an erection. And when I educate men on this, they're like, that makes no sense. I know, but that's the way it is. So you need to have an adequate amount of female dominant hormone in you to get an erection. Sounds a little weird, but it's true. So if all of the sex hormones are imbalanced, or if you have what's very common in men is estrogen dominance, because testosterone is low, you will also get erectile issues, but you'll also get a change in your body morphology and the composition. So I've used these terms before on the podcast, and I hate saying them because I feel like they're a little bit derogatory. But when we see estrogen excess, right, the man boobs, the large stomach, the sort of low muscle mass. So I hate saying man boobs, but people relate to that.
They know what you mean. They know what you mean when you say
the formal term is gynecomastia, but it's this really clear picture of estrogen dominance in a man, and estrogen can become very dominant if there isn't enough testosterone to counterbalance. But on the flip side of that, you can have low estrogen. So you can have high, you can have low, but a lot of times the estrogen will affect, like I said, erectile issues. It can affect your mood significantly. Estrogen being low or high can make you feel really moody, make you feel really anxious, make you feel really irritable. So estrogen is really important. And then the function of the thyroid is really important. So if your thyroid is not optimal, that plays a huge role in sex hormones. We talked at the beginning of the podcast about stress. So if your stress hormone, something like cortisol, is not working well, it's going to be really hard to optimize your sex hormones. And then there are other hormones that play a role in testosterone, specifically something called sex hormone binding globulin, or SHBG. It's basically a protein that increases as we age naturally, and it binds to testosterone, making it essentially inactive. So as part of our initial workup here at MedMatrix, we always check SHBG in both men and women. And this can be a really big player with testosterone optimization, because I could have a male that has all the signs and symptoms of low testosterone. His testosterone is suboptimal, or maybe not too low, but if his SHBG is really high, that essentially tells me that all that testosterone that he has floating around his body is being bound to this protein, is rendered basically inactive. So you go to your regular doctor, your family doctor, they just test your testosterone, and it's within a fairly normal range, and the doctor's like, well, you're fine. You don't have low T. It's like, yeah, but I have all the symptoms. No, you're fine. No,
Yep.
no, no, go away. You don't have any, you're good.
Yep.
So really understanding these biomarkers is extremely important. And that's really the foundation of functional healthcare. That's what we do really well here at
Yep.
MedMatrix is we understand all these biomarkers because it all plays a role. It's not just one thing. So I think that's really like the take home from a men's health hormone perspective is really, it's a very multifactorial issue. Same discussion we had with women. It's all very multifactorial. It's not just the standard stereotypical ones that a lot of people might know. So you really have to look at the whole picture.
Absolutely. We're really
Yeah.
looking at the whole person, comprehensive labs. Yeah. Not just looking at one test, one lab value.
Yeah.
Talk to us a little bit more. You mentioned this a couple times, but I think this is pretty crucial. Talk to us about kind of vascular health and sexual performance.
Sure.
What's the connection there?
Yeah. Erectile dysfunction is really closely tied to blood flow. So if people aren't aware of that, to get an erection, you need blood flow. Basically, the penis becomes engorged in blood. You have these chambers in the penis that fill with blood, and that's really what the erection is. There's no bones in there. There's nothing else that's causing that. It's really a accumulation of fluid, blood, to keep the penis erect. So vascular health is really important because if you don't have the ability to get the blood to the penis, it's not going to really get erect. And there's an analogous phenomenon that happens in women where, part of the female organs also become engorged, and that is important for, sexual stimulation and orgasm. So there's all these different things that really need to come together from a hormonal and chemical perspective for erections to really happen. Also neurologic. Before we signed on to our podcast, we were doing some research about ED medications to kind of prep for this. And I know it was a lot, right? We knew it had to be a lot. But when I was doing my research, the global erectile dysfunction drug market is valued at over $3 billion as of 2 years ago. So who knows what it is now?
Right.
And it was actually very interesting that the Department of Defense for the United States government spends over $85 billion annually to prescribe ED medications to military personnel and retirees. It's so interesting when you think about some of these numbers. It's like, holy crap, that is fascinating. But so what does that mean? Well, it means that a lot of men potentially have some sort of issue in the chain of command that is required for erections to happen. So you need the vasodilation, which is the expansion of the blood vessels for the blood to come in. So you need things like nitric oxide, which is a really important chemical for dilating the blood vessels. You need really healthy tissue of the blood vessels. So one of the biggest things I ask men about, and I know you do too, is have you smoked? Oh yeah, right. I pack a day for 20 years. Okay, well, because you smoked, cigarette smoke and nicotine can damage the very small vascular channels that the blood fills with to get an erection. So if you damage that, and it can be permanent damage, it's going to be very hard for you to get and maintain an erection. If you have cardiovascular disease, for example, plaquing in the arteries, where there's a blockage of the vasculature from plaque from cardiovascular issues, that's going to be a limiting issue for the erection to happen. If there's blood pressure issues, or you're not able to have enough blood pressure to support the blood in the penis, inflammation. So a lot of times when we see erection issues in context of men with, obesity or prediabetes or elevated cholesterol markers, inflammation, it's really a sign of early cardiovascular disease. We really take that as a sign of, okay, that's one of the first things to kind of start to go. Because what happens is blood flow is put to the trunk, your midsection of your body, and your penis is considered an appendage, like your feet, your hands. So we put blood flow more to the middle of the body to protect all your organs when there's a blood pressure issue. So you can start to get erection issues, or neuropathy or numbness in your hands and your feet can be a sign of some sort of disease process, diabetes or cardiovascular disease. So
Yeah.
it's a really important thing to talk about. It's not just, oh, you show up at your family doctor and, oh, I have erection issues. Okay, well, here's a pill.
Mm-hmm.
Not that, I'm saying that's a bad thing, but this is really a deep dive into the health of the man as he is. There's probably a lot of things that need to be addressed there when you start to
Sure.
have erection issues, both physical, like I said, mental health stuff. It's all really important. So taking
Okay.
a pill, it might work, but it's not going to fix the root problem, which is really what we're trying to do from a functional medicine perspective. So
Right. Absolutely.
yeah. Are you seeing anything else when it comes to some of these erection issues? I'm just curious.
I mean, yes. I mean, more often than not, if somebody has ED, I would say more often than not, and this is just clinical observation, those are the same patients that will often be overweight or obese.
Mm.
If they don't already have cardiovascular disease, they have these, elevated inflammatory markers. They have these kind of high risk factors for cardiovascular disease, as you mentioned, prediabetes. Like, they may not be diabetic yet, but they are pre-diabetic. And these are often the things that we're catching maybe for the first time for this male patient, because it's almost always the first time that he's receiving such a comprehensive panel of blood work. And so, yes, I would say there's, usually it's almost like it's a symptom of something broader, which I think is a great piece in terms of talking about, like, some of those ED medications, right? And that things like sildenafil, and they can play a role, but I feel like you and I, as functional medicine providers, probably wouldn't be doing our job if we didn't look at the whole person and at these other issues. If we were just kind of, as you mentioned, just giving a prescription, then that's not really the root cause medicine that we prefer to practice. Talk to me a little bit about any differences or additional considerations when you're looking at sexual health across diverse male populations. Again, whether that, I think we often talk a lot about, men who are in relation with women. Is there anything, when you're talking to men who are in sexual relationships with men, or is there anything different, additional, that you feel comes into that conversation?
Yeah, I think our job as clinicians is obviously not to judge, right? And
Mm-hmm.
you said this very, very eloquently when you talked about women's health, about how women sometimes feel shame to talk about their sexual needs with a provider. And sometimes if the provider is a female or a male, sorry,
Right.
if a female is trying to talk about her sexual issues with a male provider, it might be difficult. So, sometimes men maybe are more comfortable to talk to me because I'm a male, I might understand, versus say with you. And it's something to do with you, with your clinical
Yep.
abilities. But,
Yep.
when we talk about sexual preference or just sexual health, I think we're living in a time now, in a part of our culture where sexual fluidity is much more common,
Okay.
right? People are, both men and women are experimenting with the same sex, the opposite sex. There's a lot more kind of diversity in just sexual exploration, I
Sure.
think.
Yep.
So it's our job to understand that, and that is a thing, and it's not to shame, but it's to educate on potential, health risks, or if it affects the way they might be sexually performing. So
Mm-hmm.
when we specifically talk about men, like I was saying before, if men are the predominant penetrative partner,
Mm-hmm.
then obviously it's more of a, for them, performative, right? I have to get
Sure.
the erection, if I don't, I might not be able, and some men think, and some people just in general, both genders, it's like, well, if there's no penetration, then there's no sex, right? And sex can be not necessarily penetrative, right? There's oral sex and anal sex and all these different things. There might not be penetration of any kind, depending on your preference. So for men, it really comes down to, well, am I the penetrative partner and I feel like I have to perform, right? I have to achieve the erection. But for, say, men who have sex with other men, there can be a penetrative partner, there can be a receptive partner. So we have to talk about the risk of potential sexually transmitted infection. If you are a receptive male partner with another male, your risk of, say, HIV or other sexually transmitted infection is higher. It's much more difficult if you are the penetrative male partner to get an STI. Doesn't mean it's impossible, but it's just more difficult if you're the one that's the penetrating partner. So, we talk about, I've had, discussions with men where if they are, say, a penetrative or a receptive partner to penetrative sex by another man, we have to talk about cleanliness, right? If you're having anal sex, right? If you are practicing anal sex that a way is anal oral sex, right? If your mouth is on another person's anal area, there's risk of infection, right? There's infection there. There's cleanliness that has to be discussed. And so there's lots of things that's important. And you talked a lot about women in this way too, about, making sure women are comfortable as receptive partners for sex, right? Do they feel comfort? Is there enough lubrication? Do they feel safe so that they can feel relaxed enough to have penetrative sex? So the same thing for men, right? If a man is a receptive partner, is there, enough lubrication? Is there cleanliness that's been discussed or taken care of? The anal canal is not very open. You have to kind of, there has to be a sort of effort to perform anal sex. You have to make sure there's comfort and there's enough lubrication for things to work smoothly and there's no pain. Same thing with oral sex, right? We have to be concerned about making sure that comfort level is appropriate and that there's a level of appropriate, like, lubrication from either the mouth or something else. So there's a lot of things to consider, and this is where I think men and women too become more, I don't want to say uncomfortable, but it's not something they feel that they know how to talk to about with their doctor.
Right. It's certainly not the norm.
It's not the norm, right? So if I'm, a patient and I'm trying to understand, say, as a male who has sex with other men, and I'm trying to understand my role or what I need to do or how to be comfortable, or if I'm the receptive or penetrative partner, how do I get information about that? Maybe you talk to your friends, maybe I don't know, YouTube, I don't know. Right. So, but it's a really important discussion that you can have with, like, one of us. Cause it's really important as part of the overall health care, because it's still a sexual period. It's a sexual relationship that you need to optimize. And the comfort is really important. So we talk a lot about STIs. We talk a lot about comfort, stress levels, all that stuff. So really important stuff. And it does get into the primary care realm, right? We're not primary care providers. MedMatrix is not a primary care office, but this is just general healthcare, right?
Absolutely.
If I have concerns about people's sexual health and sexual infection, we need to talk about it.
Absolutely. And I think, one of the well, a couple things. One, I think that it's just so important to have a provider that both the patient and the provider feel like it's a safe space and it's a comfortable space to talk about, and the provider is kind of educated in that. And we do have the benefit of having, lengthier visits than most primary care offices do. So I think that is another kind of benefit. And
it's like if you want to come in and take up a whole hour talking about your sex life, great.
That's okay.
We're happy. That's okay. Right.
Yep.
Because it's a big part of health and it's health
Yep.
care, and it shouldn't be looked at as shameful. But I do
Mhm.
think if I had my druthers, I guess one of the things I would do, amongst many things, to fix sort of healthcare education in the United States is do a lot more sexual health care
Yeah.
for
Yeah.
providers so they know
Mhm.
how to talk to their men, their women, their gay men, their lesbian females, their trans patients, people that are having sex with different genders at different times, different kinks, different things that people do sexually. Because if you don't feel like you know what you're doing, or you don't feel safe, or you don't know some of the parameters, that's when you run into issues,
Mhm.
right? So we want patients to feel confident about their sexual health and their sexual wellness, and we want people to feel well informed, both men and women.
Absolutely.
And also from like a male perspective, we want men. I try to educate men a lot on how to understand their body physiology, right?
Mhm.
How to understand, if you're not performing, well, what could
Mhm.
that mean,
Right.
right? It's not a diss against you. It's not a dig. It's not, a reduction in your manhood, right?
Mhm.
There's this power play sometimes that is affected by it. So it's really just trying to understand a lot of the different ins and outs. So yeah, I think it's so
Absolutely.
important.
Yeah. Yeah.
Yeah,
So we've kind of touched on this a little bit, but from like I think we've given little bits and pieces, but if you could kind of like summarize from a functional medicine perspective,
sure.
especially here at Med Matrix, like what would without obviously giving specific treatments, but like in theory, what would a comprehensive treatment approach to men's sexual health look like? Like, what do
Yeah,
just to kind of summarize what we've talked, these different pieces, if you could put it together in a couple sentences.
sure. Yeah. So every patient that walks in the door, whether you're a man or a woman, you will get a very comprehensive blood panel to sort of start your journey with whatever you need. So that will include full hormones, all the hormones that I've been talking about. We do in everybody, men and women. We do full cardiometabolic evaluation. So we check for different markers of cardiovascular disease. We check for insulin resistance markers, inflammatory markers. We look at nutrition status. And then at the first visit, we really get to know the patient. Like I said, from a male perspective, tell me about your stress. Tell me about your diet. Tell me about your sex life, right? Are you married? Are you coupled? What are you doing? Is that a major concern? If it is, let's go through the whole thing, right? How's your stress at your work? How's
Mhm.
the interplay with your relationship? So we're really trying to get to the root cause of things, because if a man starts having ED issues, erectile issues early on in life, 30s, 40s. And, not that it's necessarily a good time to ever have it, right, in a man's life, but if he feels really more on the younger side of life and there's issues going on, are we just supposed to be giving that man medication?
Right.
Like, okay, well, because the thing too that happens a lot with men is they get in their head.
Mm.
When it happens once,
Mm.
when you have performance issues once, it sticks with you. You'll get it again and
Mm.
again, and you'll get performance anxiety. And maybe you're single and you're dating, and it's like, the whole time you're on this date, maybe you're on like a third date or something with somebody, and it's like, okay, are we gonna like get busy later? Well, oh God, I couldn't get hard last time.
Yep.
So it's all you're thinking about. Oh
Yep.
God, well,
Right.
I
Right.
hope it works. I hope it works. I hope it works. And then it's like, okay, you're kind of like making it happen. It's like, all right, and you're not even there, right? You're in your head. Oh my God, I'm not getting hard. Oh my God, I'm not getting hard. Oh my God, she's gonna think I'm so weird. She's gonna laugh at me. Oh my God.
Mm.
So there is so much that goes into this that we have to talk about from a sexual health perspective in men and in women, as we talked a lot about last week. So it's really not shameful. It's not to embarrass. It's really to say, listen, there are core principles that need to be discussed here, because if we don't, this is going to keep going. It's not going to
Yep.
stop. And if you don't break the cycle, how does it end? And you see your primary care doctor, and the primary care doctor is like, oh, well, here's ED medication, and say they try it and it doesn't work. oh my God, I'm only 34. I can't get hard. What's wrong with me? I don't know what I'm
Mhm.
doing, blah, blah, blah. And I'm trying this medication. It's not working. It just spirals. And I think that
Yeah,
happens more for men because, as I said, I think as a general, men feel like the performative partner
sure. Yeah,
sometimes.
yeah,
They're the one that has to maybe penetrate in the sexual act more often. So it's really, really a cycle that men get into. So addressing these things early
mhm,
on is key
absolutely.
key, and from a functional perspective is best, so you can
Yeah,
understand all the different possibilities.
that's a really good point. The performance anxiety aspect of ED.
Yeah.
Yeah, I think that's really important. And I want to move quickly. I want to shortly. We're going to move into a little game that I hope is fun. But
Okay.
I feel like I'm just really feeling the importance of, again, these conversations and just having the opportunity and the ability for people to have these conversations with their provider, and thinking about young men, but even not young men, and kind of the impact of pornography. And kind of,
Oh
if
yeah.
somebody, if you're going to learn about sexual health from porn versus a knowledgeable, not shaming medical provider, like, yeah, which way
Yeah.
to go in that one? That's not a hard one, so to
Right.
speak.
Right.
Yeah.
And I think it's a really good point, and I'm glad you brought this up because, as I said before, I think we're living in a day and age where both men and women are more freely exploring their sexual side or their sexual
Mhm.
interests. There's not so much. Again, I'm very much generalizing, but years ago it was more shameful, to be gay or to have same-sex relations with a
Mhm.
male. There are a lot more men that may identify as straight, but they enjoy sex with men.
Sure.
There's this whole down low culture in the gay world where men sort of live a straight heterosexual life. Maybe they're married, but
Mhm.
they enjoy sexual relations with other men. So understanding this is really important because, like I was saying earlier, we want to understand, your risk of HIV or
Sure.
STDs,
Yeah.
STIs. But yeah, for younger generations, if you're really trying to learn about your own sexual health and sexual desires, and you're using pornography in a world of the internet is at our fingers all day long, right? We're on a phone all the time, and there's highly sexualized things that are not pornography all the time, right?
Absolutely.
Men and
Yeah.
women are supposed to look a certain way based on fitness influence culture and, reality television shows. Everybody's beautiful, everybody has a six pack, everybody's whatever. So if you're learning about your own sexual health from this media, it can be very damaging for both men
Absolutely.
and women.
Yeah.
And like I said, I feel like men a lot can be a lot worse because they feel like they have to be the ones performing.
Right. Right.
So if there's this whole sort of issue with performing, and it could be related to pornography and how they're learning about their sexual health, it could be damaging for a long time. We should do a whole podcast on healthcare and pornography and
Yeah.
or like media and health,
The impact. Yeah.
pornography, the impact. I think that would be very
That would be
interesting.
great. Yeah.
Yeah.
Absolutely.
Yeah.
All right. You ready for a game?
Yes.
Okay.
Should we tell people to ask questions if they have
Yeah,
questions for after?
if you're listening, if you're watching, please
Okay.
post some questions. We're going to get to questions right after this game.
Okay. I'm down. Go.
Yeah,
What kind of game is it?
this is a take it or leave it game.
Fun.
Okay.
Okay.
All right. So, take it or leave it. Most cases of low testosterone can be reversed naturally without TRT or testosterone replacement therapy if root causes are addressed.
True. Take it. Yes.
Take it or leave it. Erectile, these are not easy, by the way. Erectile dysfunction is primarily a vascular issue, not a hormonal one.
False. Leave it.
Got it. Take it or leave it. Modern environmental toxins are a major driver of declining male fertility rates.
Take it.
Mm-hmm.
True. Very, very much so. Yes.
This is kind of what we were just talking about. Take it or leave it. Pornography is one of the biggest unspoken disruptors of male sexual performance today.
Take it. True. Yes.
Okay.
Big time. Yeah. I think we should have a whole discussion about that. I think it's highly important.
Yeah, it is. intermittent fasting can harm, this is a little loaded. Intermittent fasting can harm testosterone levels in already stressed or undernourished men.
Take it. Yes.
Okay.
Definitely.
Okay. Interesting.
I know you're trying to be tricky with me today.
I
Jeez,
know.
thank
I
you.
know. Take
You're
it or
making me
leave it.
think.
I think I know how you're going to answer this one. Strength training is one of the most powerful natural prescriptions for improving male sexual health.
Take it. 100%.
Okay. Yeah.
It's my life.
Take it or leave it. Most men are deficient in key minerals like zinc and or magnesium that directly impact libido and performance.
Take it. True.
Take it or leave it. This one's interesting too. Sleep is more important than diet when it comes to optimizing testosterone.
Oh, geez. Can I
You might be off the hook on this one. You might not have to decide
can
on
I
this
say
one.
both?
Both,
Can I be
absolutely.
like, can I be a neutral country like Finland or a neutral
Right.
nation somewhere?
Absolutely.
Both. Both.
Both, right?
Take it and leave it. Yeah, it
Right.
depends on the man. Yeah, if you don't have
Absolutely.
either, you gotta have both.
You gotta have both. We didn't really touch on this, but take it or leave it. SSRIs and other common medications are an under-recognized cause of sexual dysfunction in men.
Take it. True.
Okay.
SSRIs are a type of antidepressant for those
Mm-hmm.
listening.
Mm-hmm.
Antidepressants, one of the main symptoms is erectile dysfunction.
Yep.
So yes, take it.
Yep.
Totally.
Take it or leave it. Libido is a reliable indicator of overall metabolic and hormonal health in men.
Yes, take it.
Yes,
I think that was the
absolutely.
first thing we said.
Exactly. Right? Like you
Yeah.
said, if there's one take-home message today.
Yep.
Yeah, the only other type of medication, I think we might have talked about this last week, but that some of the medications prescribed for hair loss, like finasteride, and I don't know if
Dutasteride.
minoxidil, but yeah, will
Yeah.
have sexual side effects.
Yeah. Yeah. I don't know about minoxidil either because minoxidil is not the same
It's a
type of
different
drug.
mechanism of action.
It's a
Yeah.
different mechanism, but
Yeah.
finasteride or
Finasteride.
propecia, also
Right.
known as propecia, and dutasteride
Yeah.
are very common side effects is erectile dysfunction. And a
Dysfunction.
lot of young men take them to prevent hair loss.
Hair loss. Yep.
Mm-hmm.
Okay. So, are we ready for some questions?
Sure. Yeah. If you have questions,
Okay.
please ask your questions.
All right. We have one here that's how does blood pressure affect ED?
So I touched upon this a little bit earlier. Blood pressure can affect ED because if there is a vascular issue, like cardiovascular disease, plaquing of the arteries, which could be affecting blood pressure, it can affect essentially how well the penis is engorged with blood during arousal. Also, if there isn't high enough blood pressure, I have seen this in men sometimes where they're on blood pressure medication and their blood pressure kind of runs too low. It's like, well, you don't have the blood pressure that's high enough to support adequate blood flow to the penis to maintain erection. So it can kind of go both ways. But a lot of times if there's blood pressure issues, it can be a sign, could be a potential sign of cardiovascular disease. So that could be a vascular issue. But a lot of times with blood pressure issues, there's a problem with what we call the endothelium, which is the inner lining of the blood vessel. So if there's damage to that, it prevents the ability for the blood vessels to expand appropriately for blood to engorge. So it can be a very multifaceted problem. And I've seen a lot of men with blood pressure issues have low testosterone. Get their testosterone better, the blood pressure comes right down. And I've had many a male patient where we have to contact their primary care doctor and say, hey, their blood pressure is running too low. They're like having fainting spells. You got to get them off this blood pressure medication because their testosterone's better. Yeah.
Interesting. Really interesting. So if they're if a man was having, low libido, erectile dysfunction, and they want to restore not just that type of function, but just like overall vitality, like what are some immediate steps that that man could take?
So from a functional medicine perspective, we're trying really hard to prioritize the basics initially, right? When you walk into our clinic at MedMatrix, like I said before, we get a very, very, very comprehensive blood panel, where we're looking at all the different markers I was mentioning, hormones and blood sugar and metabolic markers. But when we take initial steps, right? Because a lot of times blood work and dysfunction in the body, that's not something we're going to fix right away, right? Sometimes if a man starts, say, testosterone replacement therapy, a couple weeks go by, he will feel a lot better. But you really have to get down to the basics. So prioritizing sleep and recovery is really important. We're talking about also nutrition. What are you eating every day, right? Are you getting enough protein every day to complement your hormone production? Are you strength training? Are you not? Are you more sedentary? Do you like get up and walk around like during the day? Are you sitting all day?
Yeah.
So how's your stress level, right? Are you partnered? Are you married? Do you have a family? Do you not want sex because you're stressed to hell, right? That's not going to
Right.
be good.
Yeah. Yeah.
And I'm not a therapist, right? You're not. We're not mental
Right.
health
Yeah.
professionals. I don't have a degree in that, but I would say I spend a good amount of time sometimes talking about almost like therapy. I'm sure you do
Sure.
too with
Oh, yeah,
patients where
absolutely.
it's just
Yeah.
like, I say that it's like, I'm not a therapist. I can't be your therapist, but you know, I'm going to tell you that if your relationship is really struggling, if you're having all these other things going on, it's going to be really hard for you to have good sexual health, or even good physical health. So that's something we always talk about. As I said before, we evaluate hormone and metabolic tests. We talk about lifestyle. We talk about adjustments that can be made. So that's where we start.
Absolutely.
Yeah, yeah.
I want to get one last question from one of our
There's
viewers
a
in.
couple questions. There was one
Yep.
up at the top
Yep.
too. So yeah, there's a
Yep.
couple.
So, what would cause loss, or I think it's loss of erection, I think is what this person's asking during intercourse.
So I'll make some assumptions with this because I'm not sure. So if there was an erection maintained to begin intercourse and then it sort of stopped, that could be myriad of issues. It could be hormonally driven. It could be vascular. Also, there could be some level of physiologic stressor on the body that could be affecting things. There can be performance anxiety. So sometimes we talked about this a little bit before, but sometimes men can get enough sort of stamina to get it going and then it
Sure.
falls off.
Mhm.
If your nervous system is not functioning properly, it sort of you get going, but it doesn't last. A lot of times though, there might be a vascular issue there where it's like you get enough to get it going and it falls off. So those are some of the biggest things. Also hormones. Those are some of the bigger things. Am I missing something? What do you think?
No, I mean,
I
I
think that's
think
most
I
of it.
think that
Yeah.
in addition to, again, some of that emotional, that performance
Mm.
anxiety piece that
Yeah.
you alluded to earlier.
Yeah.
Um, I think we need to start wrapping it up,
Sure.
since we're running out of time. Um, Tell me kind of one of the main things that you got from this episode.
Yeah, so I hope people got a lot out of this episode, and I hope a lot of people got a lot of good things about this whole sexual health series that we did for both men and women. Sexual health is not separate from your overall health, right? It reflects how well your hormones work, your blood flow, your metabolism, your blood sugar. When everything's optimized, your performance is something that can improve naturally. So I think that's a really important takeaway. And I think it's a really important takeaway for people to really be more in tune about their sexual health, not be embarrassed about it.
Mhm.
Talk to your doctor if you need to about it. If they don't want to listen, find someone else to talk to, right? If they don't want to listen, then they're not good to help you. So we talk about sexual health all the time. I
Mhm.
do, you do.
Mhm.
It's a part of our sort of whole story at MedMatrix. It's part of the functional medicine sort of tenets is talking about this.
Yep,
So
absolutely.
yeah, it's really important. Yeah.
Yeah. Yeah, I just appreciate the broad picture and the kind of trying to remove some of that like we said at the beginning, some of the shame, some of the taboo around this, and yeah, hopefully empowering some of our listeners to, to initiate some of the questions. And I think it's okay to kind of test your provider and test their comfort level too, right?
Right.
I think that's okay. So I'm just want to thank our listeners and our viewers for joining and for engaging and for asking questions. It's like really rewarding to us when people are motivated and want to feel their best and feel and know that they kind of deserve something more and something better. And that's kind of why Dr. Renaud and I think I can speak for you, kind of really love doing what we do.
Yeah.
If you want to watch this episode or you want to share this episode with somebody else, you can find this episode and all the other MedMatrix podcast episodes on Apple, on Spotify, on YouTube. And if you want to learn more, if you're interested in potentially becoming a patient and you are not already, you can go to our website, medmatrixusa.com. You can get started. We have a great team who does discovery calls, can answer a lot of your questions in terms of how it works and the best way for you to kind of get started and to work with either Dr. Renaud, myself, or we have 3 additional really qualified providers. Anything you want to add in as we wrap up?
No. Yeah. I mean, we offer free discovery calls. So, there's no cost
They are
to even
free.
just,
They are free. Good
yeah,
point.
there's no cost to even just inquire. You have to be a resident of Maine or New Hampshire to be a patient as of right now. But yeah, if you're listening to us on any of our streaming platforms, we are here 1 to 2 times a week. We talk all things functional medicine. So I think we had a great episode. I'm glad we did this.
Yeah, likewise.
So thank you for
you.
taking the reins.
Absolutely. All right. Well, good night, everybody.
Bye.